1, 2. Your Majesty, King Letsia III of the Kingdom of Lesotho, and Her Majesty the Queen Emakosigati, Your Excellency Jakaya Kikwete, former President of Tanzania and the founder of ALMA, Your Royal Highnesses, Prime Minister, Councillors, Chiefs, Chief Justice, Deputy Prime Minister, Dr. Hala Zaid, Minister of Health, and Minister of Health from Egypt, representing the Chair of the African Union, Deputy Prime Minister, Your Excellency Amir Al-Fadil, Commissioner for Social Affairs, representing the Chair of the African Union Commission, Ministers of Health representing their heads of state and government present here today, Cabinet Ministers, members of the Diplomatic Corps, partners and international organizations, members of Rollback Malaria, business community, Executive Secretary of ALMA, and members of staff, Executive Secretary of SADC, presiding officers and members of both houses of Parliament, regional administrators, ladies and gentlemen, Sinfusela Kulu Begunen. It is a great honor for me to be with you all here to launch Eswatini Malaria Fund. This is an initiative aimed at mobilizing resources to eliminate the disease from the face of our kingdom, the region, and the entire African continent. We welcome you all, in particular His Majesty the King and former President, our distinguished guest from across a wide spectrum of the African continent, as well as partners and sponsors of the End Malaria campaign from different parts of the world. Your Majesties and Excellencies, you will recall that we, the African heads of state and government, agreed that first 10 years of our Vision Agenda 2063, we would create the Africa we want. It is clear that a pivotal part of that vision is a continent free of diseases, of poverty, such as malaria, which would unleash the quality of human capital and levels of productivity required to end poverty. It is for this reason that the continent pushed for a sustainable development goal target of ending the malaria epidemic. Today marks a significant milestone in the history of the fight against malaria, not just for Eswatini, but for the whole of Africa, as we take yet another step towards eliminating malaria in our lifetime. We are all aware that our governments spend a lot of money fighting malaria. Time has come for us to unite and declare a zero tolerance to malaria. As you all know, the mosquito knows no borders. Therefore, we have to work together as African nations to eliminate this challenge which has deprived us many of our beloved friends and relatives. I wish to congratulate our brothers and sisters in the Democratic Republic of Algeria, who were last week certified malaria-free by the World Health Organization. We join Algeria in celebrating this important achievement, and it gives us encouragement that we can indeed eliminate malaria from the African continent. Yes, we can, if we fight it as a collective. Since the launch of the Millennium Development Goals in 2000, significant progress has been made in controlling malaria. As a result of these efforts, millions of cases have been avoided and lives saved in many parts of our beloved continent. Just in this decade, the malaria incidence has declined by 20% and the mortality rate by 40%. This means that more than 50 million malaria cases and 270,000 deaths are avoided annually. I am happy to pronounce that the Kingdom of Eswatini is one of the few African countries to have met the target as indicated in the Millennium Development Goals long before the target date. Following the significant achievement by the Kingdom, the World Health Organization classified the country as ready for malaria elimination. For the country to qualify for malaria elimination, some of the following robust systems have been put in place. Malaria treatment in our health facilities, including private sector, is provided free of charge to the population. Government ensures that anti-malaria drugs are always available in all health facilities. All households in malaria risk areas are sprayed once a year with residual insecticides, and we maintain a high spray coverage area of up to 90% consistently. Government distributes bed nets to all populations living in malaria risk areas with a special focus on pregnant women and children less than 5 years. The country has a surveillance system which helps to map out specifically all confirmed malaria cases and all interventions delivered in each household. This has helped us understand in real time what is happening and where. The Kingdom has invested a lot of resources in the area of research to ensure that the strategic direction of the program is always informed by scientific evidence. Government continues to conduct research on the drugs and insecticides to ensure that they are still effective against the mosquitoes and parasites. We have established and strengthened collaboration with our neighbors, South Africa and Mozambique, through the Lubombo Special Development Initiative to address the issue of cross-border transmission. The investment on cross-border collaboration is very critical because the mosquitoes and parasites respect no political borders or boundaries. The implementation of the above interventions would not have been possible had it not been for the commitment of government. Government has been putting up to 70% of the resources for the implementation of malaria elimination interventions. However, the recent 2018 World Malaria Report by the World Health Organization was a wake-up call because it indicated that progress against malaria is stalling and the resources available for malaria are at risk. The report was a call to action. The report was a call to action that progress needs to be accelerated, especially at the national and local level. Your Majesty, Your Excellencies, ladies and gentlemen, you will recall that together with His Excellency Macky Sall, President of Senegal, we launched a continent-wide campaign, Zero Malaria Starts With Me, last July in Mauritania. This campaign, endorsed by the heads of state and governments of Africa, promotes strong national ownership of malaria, not just in the health sector, but across all sectors and at all levels, from the cabinet table to the household level. We all have an important role to play. Today, I'm delighted to announce that the launch of the Zero Malaria Starts With Me campaign for the Kingdom of Eswatini and our goal of eliminating malaria in the Kingdom by 2022. We call upon all politicians, public servants, private sector, youth chiefs, and other traditional leaders, many of whom are in attendance today, to stand up and declare that zero malaria starts with me. Together we can make Eswatini the first country in sub-Saharan Africa to eliminate malaria. One important step to ensure that we remain on course to eliminate malaria is to provide enough resources for a sustained campaign against malaria in the Kingdom. The Kingdom faces a $5.5 million budget gap to eliminate malaria. If we cannot fund the spray teams that protect those at risk, respond to each case in a timely manner, and monitor cases that cross our borders, then the progress that we have made will be at risk. Today we launch the first National End Malaria Fund. This fund exists to mobilize the resources necessary to close the funding gap and ensure that we eliminate malaria by 2022 and then prevent the reintroduction of malaria thereafter. This fund is a public-private partnership composed of representatives of the public and private sectors as well as representatives of communities. The fund will be managed by a board of directors. Over the years, we have seen how the private sector, working with the government and other stakeholders, has effectively contributed to the implementation of priority national initiatives. I urge the private sector and all of us to contribute to this fund. To my African leaders, I would like to thank you for all that you are doing to make sure that malaria is eliminated from the African continent. We need to expand domestic resources for malaria and establish multilateral funds for this cause. To our many partners of the RBM Partnership to End Malaria, thank you for your ongoing support for these efforts, and we call on you to help accelerate these initiatives. As I conclude, eliminating malaria is like climbing Sibebe. The famous granite mountain here in the kingdom of Eswatini, for those who don't know it, and I would advise you to visit that area. At the bottom, you look up at the peak towering over you, and it is a bit daunting. But the challenge is invigorating, so you can start the climb step by step. Along the way, there are many beautiful views with moments where you can pause to celebrate and admire the progress that you have made. But you continue yet again, step by step. At some point, however, your legs begin to tire. Your feet are sore. You look up at the peak and the top is in sight, but still a distance away. So you have a choice to make. Firstly, it is either you can feel good about what you have accomplished and turn around, backtracking down the hill, or secondly, you can push on to the summit. Pushing ahead when you are tired is courageous and something that we are all capable of doing. We must persevere. We cannot backtrack on the progress that we have made. Let us get to the top of the mountain so we can declare a malaria-free Eswatini and a malaria-free Africa. Let us remember that zero malaria starts with me. We take this opportunity to once again thank you all for making today's event the success it is through your commitments and pledges. We also appreciate those who have worked tirelessly towards organizing and coordinating the preparations for this launch. We further applaud the wonderful performances by the various groups. It is now my singular honor to declare the Eswatini Malaria Fund officially launched. I thank you. May Almighty God bless us all. Siyabonga.